My name is Joe Prony, and this is the Rise Above Project. And today I want to talk about how to pass the MFT licensure exam. Now, I am a licensed marriage and family therapist, but the unique perspective that I can give you today is that I also come from a sporting background and a business background. So that is going to inform some of the way that I would try to help somebody to pass this test. So let's take it from the top. The first thing that I would say is, from a sporting perspective, is that I care about winning. That's the most important thing, getting the job done. To that perspective, what I would say is, the very first day you are in school and you're studying psychology, that should be the day that you are already looking forward to passing that test. So don't think you can pass a class and then forget all the information. So you want to be able to retain all that. So let's say you're in graduate school right now. And I'll give you an example of when I was in graduate school. I went to a particular college where we would be in groups of 4 or 5. And once a week, we would have to give a presentation in front of the class. Let's say we had a certain subject matter. In that subject matter, if there's 5 people, you're only expected to do 20% of the work, because that's what you're being judged or graded on. So you do your 1/5 in the presentation in front of the class. Assuming that everybody in your group does their part, you're going to get a good grade, you probably get an A, and then you move on. But here's the problem. If you continue to do that in all your classes, you're only getting 20% of the work, yet you might have a 4.0 grade point average. So what I did, I was already aiming for the day that I was going to have to take the test. And so, yes, I would do 100% of the work. Every person in my group, they did their part in their presentation, but I could have easily have done their presentation as well. So yes, so I did the work of all the people, and then I only presented my 1/4 or my 1/5 there. But as the classes went on, I was able to have that information right there, and I was able to retain it, as opposed to going through 2 years of graduate school, only doing a quarter of the work, and then having to figure out a way to restudy all of that stuff to prepare for a test. I already had the information. So that's number one. Number two, you need 3,000 hours along with, and then to be able to take that test. So when should you take this test? What I would say is you want to take it as soon as possible. What do I mean by that? Number one, study for the test the first day of graduate school, right? That's number one. Number two, when you can take the test, you have the information behind you, you want to take that test as soon as possible. I know plenty of people that have 4,000, 5,000, 6,000 hours, and they still haven't passed their test yet. And you might think with all that extra experience, it would help them on the test. And what I would say is that it definitely does not, because being a therapist in the field takes you further and further away of what you're actually going to be tested on. Now, I know that doesn't seem to make sense right now, but it does. Most people coming out of graduate school are looking for an internship. It's very rare that you're going to be able to work for yourself. That's number one. Number two, the work that you're going to get most of the time, not all the time, but the bulk of your hours are going to be in behavioral therapy. And what does that mean? It means you're going to be working with Medicaid type of clients. Now, is this true for everybody? No. But for a large majority, it is true. What happens when you're working with Medicaid people? Typically, you're looking at one-parent households. You're looking at children that are in the foster system. You're looking at very dysfunctional families. We're looking at mood disorders, personality disorders, drug and alcohol problems. So when we're looking at that, there's certain modalities that you're going to need to help people like that. However, the MFT board that you're going to be tested on is going to be heavily weighted to family systems therapy. What does that mean? It means that it's going completely opposite of what you're training yourself or what you're doing in the field. In other words, again, how do you do family systems therapy with a child that really doesn't have a family? How are you going to do that with broken families, people from the foster system? Somebody that, let's say it's possible to bring in a family member in therapy, which that's really hard to do, actually, what I've noticed. It's not, it, when we were studying this stuff in college, it was like this utopian paradise where you would bring the child in, and then there would be the father come in and the mother come in, and then you would have this conversation about why this child is acting out the way they are, because they have actually the identified patient, but the problem really is in the system of the family, and it's obviously the parents. In the 10 years so far that I've been working and all the therapists that I know, this rarely ever happens. It's a difficult situation. The only time you get people like this are people that are very well to do, and they're also very well balanced, well adjusted people that are looking to go to a professional for help, and they don't take things personally, and they don't have mood disorders, and they don't have personality disorders, and most likely they're not having some type of addiction as well. This doesn't happen that often. So when you're looking at family systems therapy, you're looking at Bowenian, structural, strategic, Milan therapy. Now, if you go through psychology today, for example, and look through all the many therapists that are there, and you look at the modalities that they use, what are the chances of them saying that they use Milan therapy, strategic, structural, Bowenian? It's so rare, you're not going to see it. And that's my point. So the longer you're in the field working, the longer it's taking you away from the things that you need to study for on the test. Let me give you a funny example. We used to, and I'm Italian, so I love this Milan therapy. It sounds great. But what it is that you bring the whole family into therapy. I've almost never have seen this. Like, it's hard to get people to do that. So that's number one. The other part is, it's not just the family. You're talking about a team of therapists. And again, in all the agencies that I've seen here in Las Vegas, I have never seen a team of therapists working with a whole family unit. I've never seen it. And yet that's what you're going to be tested on. So how do you learn that? Well, you need to study it in a book, because you're not going to get actual experience with it. It's not going to happen. I mean, maybe it could. I shouldn't say it'll never happen, but the chances are very slim. The other thing, when I took the test, that was very interesting. It was very heavy on genograms. Again, I don't know any therapist who uses genograms. I can't think of one. Maybe one therapist I know mentioned it, but it's not really a thing that therapists really rely on. So if you're not using it in your normal everyday work with people, it's going to be very hard to memorize all the little details of doing a genogram. So you're going to have to study that on your own. Now, more details. What I would do is I would spend the money. I think it's about $300. You want to buy the MFT exam prep, and with that, you can take as many tests as you want, and the questions are coming from previous tests. So that'll be very helpful. That'll give you an idea of what's going to be on the upcoming test. And it'll also give you some details on different types of therapies and stuff like that, so you can study that. The one that I use, you can watch videos, which is always good. And again, what I would do, and again, coming from a sports background, to me, every time you're being lazy and you're not doing the work that you should, somebody else is. And so therefore, if I'm going to drive from my house across town to go somewhere, if I don't have my phone on and I'm listening to one of the videos there and I don't have that in my head, it's a waste of time. Listen, I love music as much as the next person, but I don't have to hear Hotel California, Stairway to Heaven, or Freebird for the 8,000th time in my life. It's getting in the way of my studying for this exam. So that's what I did. I would not listen to music. I would listen to the lectures, and I would have that on my head the whole time I'm doing something. And so you have that, and then let's talk about the actual exams to take those. First of all, I think you want to try to be an expert in the modalities, like we've talked about, all the family systems, therapies, and stuff like that. You want to be an expert in knowing how to diagnose people, what mood disorders are, what personality disorders are. Become very good at the specifics of that. That's number one. So if we're looking at a sporting analogy, you would say, for example, in basketball, practice your free throws, practice dribbling, practice your passing. Okay, that's the individual part. But now you want to put it all together. So how do you put it all together to pass this test? Well, you want to take the test. So I took the test. I started 6 months in advance of the actual getting down to business of doing the testing. And I took one test per day, every day, for 6 months before the exam. That's what I did. Somebody might say that that's a little bit excessive, but I don't care. To me, it's all about the win, and what else are you going to do? If you have something that's that important and it's on the line and it's going to affect your life, what are you doing that's more important than studying for your test? Work, sure. Sleep, sure. But then get back to the business of studying. So the test itself, they give you 4 hours. What I did was I was testing so much. As I said, I was testing every day, that I narrowed it down to about an hour and 5 minutes to an hour and 15 minutes at most that I would take this test that was supposedly for 4 hours. So I was able to do it super quick. I knew what I was doing. It became very easy. That was in terms of speed. In terms of my grade, I was aiming somewhere between a 92 to I think a 98, which is well above what you need to pass. So again, training. In terms of sports, you don't practice until you get it right. You practice until you cannot possibly get it wrong. Now, I see a lot of other people, they go to school, they have this other type of mindset, and it's like, well, they want to have this work-life balance. Listen, that's all garbage. There are times in your life when you really have to knuckle down and do the job. There is no such thing as work-life balance. That's for people who are unsuccessful or very successful people that have already done the work, and then you could move into a work-life balance. But if you're complaining about work-life balance now, before you've even gotten to your goal, it's going to be, it could be a roadblock to you. I'm not saying for sure, but it could be, because your work ethic is in question if you're worried about that type of thing. The other part that I would do is, now that I got the grades that I wanted and I was able to do it in a fast amount of time, now you have to look for potential problems. So let's say you're going to take the test on this particular day. There's no guarantee that you're going to feel good. There's no guarantee that you're going to feel healthy. There's no guarantee that you're not going to be stressed. So you need to train for that. So what I did was, sometime I would take the test very early in the morning. Then I would take the test very late at night. Then I would take the test after I've eaten a good meal. Then I would also take a test after I was very hungry. And so all of these different scenarios could come up, and I was still taking the test, and I was honing in on still being able to get as perfect of a grade as possible within an hour and 15 minutes. Sometimes I would stop in a parking lot where there was cars driving past on the street. Sometimes I would pull over on the side of the street, and I would take the test there. Why? Because there's incredible distractions that way. Now, is there going to be that type of distraction when you're taking a test? No, but you need to be able to be prepared for anything. So take it in as many different situations as you can. If you get into a fight with somebody in your family and your heart is going and you're a little bit agitated, perfect time to take the test when you're agitated. See if you can concentrate down on it. Because who's to say on that particular day that you're going to go take the test and all of a sudden, your dog is sick or something like that. You don't know that. So prepare. The other thing that I did was I had the location of where the test was going to be. And so obviously I had never been there before. So don't leave it to chance on the day of you're going to go driving there. I don't care if you have GPS or not. You're not sure of the lay of the land. So before the test happens, a week before, 2 weeks before, 3 weeks before, whatever, you drive to the test taking site. Take a look at where you have to go, exactly where you have to go, not just the address on the building. I want to know the exact suite or area you have to go. And do that once or twice to make it very comfortable so you've been there before. So again, you want to be able to practice everything. You want to be able to practice the actual having the information, but you want to be able to practice how to take the test and how to take it under different circumstances. Let's talk about anxiety a lot, because I know a lot of young people talk about this. And your anxiety is only going to get worse, by the way, if you fail the test, because then you're going to have to try it again, and now you're going to have that negativity in your mind. But there's this thing, this overwhelming position that people have in this country now, that anxiety is so terrible, it's so bad, you should not have anxiety, take a pill, you got to decrease it. I don't believe that at all. Anxiety is a good thing. It's telling you that something needs your attention. For example, I'm filming this on, whatever day is today, I think taxes are due tomorrow, so today's the 14th. Taxes are due tomorrow. All right. Well, I think they give you an extra day, but whatever, it doesn't matter. But here's the thing. If taxes are due on April 15th and you don't pay them, and let's say now it's April 20th, your anxiety is going to go up. That's not bad. You shouldn't shut down your anxiety. What you need to do is pay your taxes, and then your anxiety will go down. So people are so worried about their anxiety going up to take a test. Well, that's the only clue you need, that you need to study more. The more you study, the less anxiety you're going to have, because you're handling the problem. So pay attention to that. So in review, what would I do? If you're in school right now and you're in a type of program that allows you not to do all the work, that other people in your group are going to do a lot of the work, don't be lazy and let them do it, because you're only going to have to do all of that work stacked up on top of each other later on. So do the work now. That's number one. Number two, you want to take the test as soon as possible. And then you want to buy one of those programs so you can continuously take tests. That's important. And take them as much as possible and do them under different circumstances. So hopefully that has been beneficial to you in some way. My name is Joe Peroni. This is the Rise Above Project. Please subscribe and tell a friend. Thank you.